The White House Coronavirus Task Force met today, but earlier in the day, the President convened all the key elements of our supply chain team in the Oval Office for an update on the progress that we have been making, working literally around the clock to make sure that our healthcare workers, the people on the front lines, have the personal protective equipment and also the ventilators to be able to meet this moment. And today you're going to hear from the people that are literally working each and every day to make that happen. Dr. Deborah Birx is also with us. She'll reflect in a few moments on the progress that we're making, analyzing the data. Each and every day we're looking county by county, state by state, consulting with governors and local health officials. At the present moment, more than 1.3 million tests have been performed, and as you all are aware, some 236,000 Americans have tested positive for the coronavirus, with now the losses over 5,000 Americans, and our hearts are with their families. Beyond that, we have been focusing not just on ensuring the testing is occurring, but that the supplies are flowing. As the President just announced, he made a decision today to deploy thousands of N95 masks directly to New York City's public hospitals, and our team will speak about that in just a moment. And also, the President took the unprecedented step to direct the Department of Defense to use military healthcare personnel to operate all COVID facilities at the Javits Center in New York, at the Convention Center in New Orleans, and at the Convention Center in Dallas. We informed each of the governors of those states today that at their request, we were making those military medical personnel available to operate in all COVID facility. But we would emphasize to people in that community who believe you've been impacted or have contracted the coronavirus, contact your local healthcare provider. We anticipate in the New York area that your local healthcare provider will make the decision whether you are transferred to the Javits Center, and in all cases simply look to the guidance of your local governors about how best to receive the care that every American is entitled to have. Beyond that, let me say that we have been working through FEMA's acquisition process, not only to deploy, but to gather up personal protective equipment. And in just a few moments, you will hear from Admiral John Polowczyk about the extraordinary progress that we have made in deploying not just the strategic national stockpile, but also in identifying on the commercial marketplace around America and around the world, literally millions of N95 masks, surgical gowns, gloves, protective equipment. And at this point, we've distributed some 7,600 ventilators. And you'll hear today specifically about the states that have received those ventilators. This team has truly acted in an inspiring way and literally is working with dozens and dozens of people at the FEMA Stabilization Task Force to make sure that we are leaving no stone unturned to find the supplies we need. Let me also say today you're going to hear from Jared Kushner, senior advisor to the President of the United States, but someone that the White House Coronavirus Task Force directed to work with FEMA on supply chain issues. And in recent weeks, he's been leading a working group in conjunction with FEMA that literally has identified millions of medical supplies around the nation and around the world, and we're grateful for his efforts and his leadership. Finally, you'll hear from Peter Navarro, who will explain the action the President took today using the Defense Production Act. But as you hear details today about medical supplies that have been distributed, those that have been purchased, those that we're making available, ventilators distributed to hospitals, and those that are available, let me just remind every American that you can make a difference in ensuring that every patient has the treatment that they deserve, every healthcare provider, every doctor and nurse's assistant has the protective gear to provide the care that you would want your family to have by putting into practice the President's 30 days to slow the spread. I mean, we want you to take to heart the President's coronavirus guidelines for America. First, to protect your own health, to protect the health of your family, to protect the health of your community. We know so many people are asymptomatic, and people that literally don't know they have the coronavirus but have the ability to infect others. We want you to put these guidelines into practice: social distancing, using a drive-thru at a restaurant, washing your hands on a regular basis. But as we focus today on supplies, make no mistake about it, every American can make sure that our healthcare workers, and more importantly, Americans that are struggling with coronavirus, have the equipment to support their treatment by putting these principles into practice. Because the fewer Americans that contract the coronavirus, the fewer Americans will have to enter our healthcare system. And that'll continue to preserve the capacity in our healthcare economy. So we thank the millions of Americans who've responded in the first 2 days of 30 days to slow the spread. And I'm just absolutely confident that in the days ahead, every American's going to do their part for your health, your family's health, the health of your community, and to ensure the strength and vitality of the greatest healthcare system in the world. With that, let me introduce Jared Kushner to speak about the work that he's been doing, working with FEMA on ensuring a strong supply chain to meet this moment. Jared?
Thank you, Mr. Vice President, and thank you for your great leadership on the task force. And thank you to Dr. Birx and Dr. Fauci as well. It's been an honor working with you these past few weeks. When the Vice President first asked me to help on the task force with different tasks, I asked the President what he expected from the task force and how I can best serve him and the task force. What the President asked is that all of the recommendations that we make be based on data. He wanted us to be very rigorous to make sure that we were studying the data, collecting data. A lot of things in this country were happening very quickly, and we wanted to make sure that we were trying to keep updating our models and making sure that we were making informed decisions and informed recommendations to him based on the data that we were able to collect and put together. The President wanted to make sure that we had the best people doing the best jobs and making sure that we had the right people focused on all of the things that needed to happen to make sure that we can deliver in these unusual times for the American people. The President also instructed me to make sure that I break down every barrier needed to make sure that the teams can succeed. This is an effort where the government is doing things that the government doesn't normally do. We're stretching, we're acting very quickly, and the President wants to make sure that the White House is fully behind the different people running the different lines of effort to make sure that we get everything done in a speed that the President demands. The President also wanted us to make sure we think outside the box, make sure we're finding all the best thinkers in the country, making sure we're getting all the best ideas, and that we're doing everything possible to make sure that we can keep Americans safe and make sure we bring a quick end to this in the best way possible and balance all the different aspects that need to be thought of while we do this. This truly is a historic challenge. We have not seen something like this in a very, very long time, but I am very confident that by bringing innovative solutions to these hard problems, we will make progress. Today, we were briefing the President earlier. He asked me to come out and talk a little bit about what we've been doing on the supply chain task force, which Admiral Polowczyk has been leading. And what he's been very impressed by is the way that we've been resourceful to find product all over the world, all over the country, and we are finding ways to solve the different problems. The President's been very, very hands-on in this. He's really instructed us to leave no stone unturned. Just this morning, very early this morning, I got a call from the President. He told me he was hearing from friends of his in New York that the New York public hospital system was running low on critical supply. He instructed me this morning. I called Dr. Katz, who runs the system, asked him which supply was the most supply he was nervous about. He told me it was the N95 masks. I asked what his daily burn was, and I basically got that number. Called up Admiral Polowczyk, made sure we had the inventory. We went to the President today, and earlier today the President called Mayor de Blasio to inform him that we were going to send a month of supply to the New York public hospital system to make sure that the workers on the front line can rest assured that they have the N95 masks that they need to get through the next month. We'll be doing similar things with all the different public hospitals that are in the hotspot zones and making sure that we're constantly in communications with the local communities. One thing I will say, just based on data, is that we've been getting a lot of data from different governors and from different mayors and from different cities. One thing I've seen FEMA do very, very well over the last week or so is now we're getting real-time data from a lot of cities, people who have requests for different products and supplies. A lot of them are doing it based on projections, which are not the realistic projections. The projections change every day as we see the cases, as we see the impacts of the Stop the Spread effort that this task force recommended and the president has been pushing forward. So I do think that we'll see that hopefully there'll be impact of that. And the task force has been working very hard through the FEMA group with Admiral Polowczyk to make sure that we're getting the supplies to people before they run out and making sure that we're doing it in a proper way. I'd like to just introduce Admiral Polowczyk, who before coming to this, I guess still is, he's the Vice Director for Logistics for the Joint Staff. I got a call from one of the senators saying, well, why don't you put a great military person in charge of the logistics and the supply chain and the Defense Production Act? And I said, well, the president already did that. This is the best man that we have in the country for supplies and logistics. He joined the task force 13 days ago over at FEMA, and he's built a team really at the direction of the vice president that includes people from FEMA, OMB, the FDA, HHS, the White House, and from everywhere else. And what they've done over the last 13 days has been really extraordinary. We've done things that the government has never done before, quicker than they've ever done it before. And what we're seeing now is we found a lot of supplies in the country. We've been distributing them where we anticipate there will be needs, and also trying to make sure that we're hitting places where there are needs. So I can tell you the people in the task force, they're working day and night. You've got a lot of people in the government. We recognize the challenge that America faces right now. We know what a lot of the people on the front lines are facing, the fear that they have, that they won't have the supplies they need. And our goal is to work as hard as we can to make sure that we don't let them down. So I just want to thank everybody. And with that, I'll introduce Admiral Polowczyk, who's doing an amazing job.
Thank you, Mr. Kushner, Mr. Vice President. So today I'm going to cover a couple items, five things. First thing I'm going to talk about is resources pushed out from the federal government. And then I'm going to talk about this air bridge, which you may have heard about. I'm going to talk about data. As you said, Mr. Kushner is absolutely right. We're trying to be data-driven. And then I'm going to talk a little bit about how we're trying to expand the industrial base here to meet this challenge. So the first thing I want to talk about is surgical masks. So you've quickly stated numbers here. So I'm about to go through several different slides to give you just scale and magnitude of federal resources that have been applied at the problem. So 27.1 million surgical masks pushed out to state governments. For N95 masks, 19.5 million N95 masks. And so if I was in a local hospital that was running short, I would look upward because the federal government has pushed out resources. So for protective gloves, 22.4 million pairs of protective gloves. For face shields, 5.2 million face shields. For ventilators, we have pushed to the states more than 7,600 ventilators, and I think as I was coming over here, that number's changed slightly. I think it's now 7,640 given to these states, to the predominantly these states. So we wanted you to have some numbers. Now, as we've indicated, we had ventilators in the national stockpile. We pushed ventilators out. We're holding ventilators to put to the point of need, but we're also buying ventilators, asking the industrial base who produces approximately, prior to COVID, approximately 30,000 ventilators a year. We are going to, over the next several months, by the end of June, work to acquire 100,000. And so one of the tools that we're going to, I can anticipate needing, and we've already executed, is all of those vendors that we're buying them from potentially will need help in their supply chains with their suppliers. We might rate orders. We might help them get ahead of others in that endeavor. So I think Mr. Navarro is going to talk a little bit more of that later. So let me talk about the air bridge. So normally takes approximately 37 days to get from overseas, get product, load it, get it to the United States, and distribute it. That's about 37 days. So to prime the pump, so to speak, we have lined on an air bridge to get product here faster, working with our major suppliers as they work to fill orders to get more to healthcare workers now. We are working to align transportation to product. Now, one of the things we're also doing is the team that works for me are scouring the globe and finding pockets of personal protective equipment that might not otherwise be in the U.S. hospital supply chain. That is also going on these flights. 6 completed and a number scheduled. 28 flights scheduled here in the near future. We are working towards, some days we'll have 1 flight, some days there might be 2 flights, multiple flights over the next coming days. These 28 are, as far as I can see, out to a couple of weeks. Then again, matching product, 2 flights to create volume in the supply chain here faster than the 37 days. I'm just going to leave that up as I talk about a few other items. So let's talk about New York City and the public health hospitals. I believe they're called New York City Health and Hospitals. President directed, as I speak, there are pallets being formed, truck being loaded. I gave an address in New York City here an hour or 2 ago, and one of our distributors is making that happen, and that delivery will happen tomorrow. On the data front, this is almost unprecedented. This is a commercial supply chain with 6 to 7 major distributors of health equipment. We brought them all in, and we said we need to make informed decisions, and we are going to help make informed allocation decisions. So within a matter of days, feeding from their business systems, their enterprise resource-like systems, I brought on board a tool, a supply chain tower, that the DoD was using to manage a supply chain for a very complex weapon system. Their data goes into a data lake. We have a tool to be able to use their data and see it. I can tell what product is coming in, what their orders are, what they're filling, what they're not filling, and see the volume in the supply chain and understand what they're doing down to the county level. We're working to get it potentially down to the hospital level. So this 200 and some odd N95 respirators, we took a look in there in the supply chain, and we said we have the volume to go do that. I called the distributor, and they're making that happen. We anticipate, as the hotspots around the country, we anticipate these vendors at our direction helping them allocate product to the right place at the right time. So if I talk finally about expanding the industrial base. So the vice president was at Walmart the other day, who told him, I want to get in this game. How do I do that? So I got the call. We provided them specifications. And Walmart is going to use their suppliers to cut fabric, make gowns, sew product. But that's not always the case. We have lots of folks that want to help. I believe you will see in the coming days the use of the Defense Production Act in creative ways to help people that are not doing this today to do it. We have essentially leads. The number yesterday was 210. I believe it probably grew today, that we are working with to find how each one of those might need help to get in the game that's not in the game, to increase the throughput through the healthcare market. Again, the president gave me one task: get more to our healthcare workers now. And I took that to heart because I have, not that I don't need that from the president to that direction to move out, but I have family in New York. My sister's a nurse practitioner in a Westchester hospital. And my niece is a nurse on a Long Island hospital. And I have other healthcare professionals in the family. So I have skin in this game. And the president asked me to get more of the healthcare workers. I'm going to get more of the healthcare workers. I'd like to hand it over to Mr. Navarro.